Legalization of marijuana, What Parents and Caregivers Need to Know, presented by Brenda Goodwin. In 1996, California decriminalized the cultivation and use of marijuana for medical use. By 2016, 23 other states followed suit, including Maine. In 2012, Colorado became the first state to decriminalize the use of recreational marijuana. And in 2016, Maine voted to decriminalize recreational marijuana as well. In 2017, there are currently 7 states, plus Washington, D.C., that have decriminalized recreational marijuana. Public perceptions are changing. In 2015, studies showed that perceived risk of both regular and occasional use of marijuana has decreased from 2002 to 2012. Among teens, cigarette use is declining and marijuana use is increasing. Teens are also using alcohol less and using marijuana more. Increased use and lower risk perceptions means more children at risk. A 2016 study showed from January 2005 through September 2009, there were 0 cases of marijuana exposure out of 790 patients seen in the Children's Hospital Emergency Department for ingestions in Colorado. From October 2009 through December 2011, there were 14 cases out of only 588 patients that were treated for marijuana exposure. Most cases were due to a child ingesting an edible form of marijuana, such as a cookie or a gummy. Some of the effects of accidental exposure may be mild, such as lethargy or drowsiness, followed by ataxia and irritability, or they can be more serious, including coma, respiratory depression, and seizures. What can we do? Marijuana is still considered by the Federal Drug Administration as a Schedule I drug. Marijuana users need to keep all marijuana, both recreational and medicinal, out of reach from minors. Colorado has passed the Gummy Bear Law that prohibits the sale of marijuana in a candy form that would be appealing to children. This is something I believe all states should strongly consider. More studies are needed to examine the long-term effects of marijuana exposure to children and fetuses. Whether used for medical reasons such as pain management or for nausea, or for recreational use as alcohol is used, marijuana is still a drug and needs to be treated as such. Parents and caregivers, please talk to your teens and know your state's legal ages for use. And please be sure all marijuana products are out of reach of our little ones.